Hi, my name is Matthew Morales, and I'm here to discuss what it is like to work in a nursing home as a CNA. We'll also discuss the basic job description of a certified nursing assistant and how close one would work with the charge nurse. I also discuss how close a CNA's relationship should be with the nurse. I decided to write this speech because I'm a certified nursing assistant and I have been doing this work for 5 years. The following information will describe the job specifications that are expected out of a CNA and my perspective on what a CNA actually does. Certified nursing assistants, often called CNAs, are employed in hospitals, clinics, but for the most part, nursing homes. CNAs work directly under the supervision of a nurse. There are certain expectations of the nurse that you may have to follow. The CNA must perform good patient care. Sometimes the CNA will be required to perform vital signs such as blood pressure, pulse rate, respiration, and temperature. Sometimes oxygen percentage rate when requested by the charge nurse. Usually this is requested if the patient is experiencing respiratory problems. Reasons for possible vital signs might be the charge nurse the charge nurse sometimes has to monitor patients if the physician prescribes new medication, so you're constantly conversating with the nurse. Another reason would be the patient could have change in condition. Vital signs should usually be taken within 2 hours of shift change. Working on a subacute unit. Subacute units can get pretty hectic at times because of demanding situations, by supervisors' demands or patients' demands. Most subacute patients are there for rehabilitation because they're so long before the hospital can hold you as a patient. Types of patients to expect. Hip fractures, which is most common in the elderly. Quadriplegic, paraplegic, another common disability you would find. Stroke can usually occur at any age. With most nursing home patients, there are people that have AIDS and can no longer do for themselves. Sometimes they're incontinent, which means no mental or physical concept of getting up to go. With incontinence and lack of bed mobility comes bed sores. Causes of bed sores. Bed sores are medically known as DQ, which causes poor circulation. Another cause is lack of mobility. So someone might be paralyzed, which indicates lack of mobility, which is a risk factor. State requires a repositioning of a bedridden patient of every 2 hours. With proper repositioning, the bed sore will heal with time and effort. Caring for the cues. This is where the nurse and the CNA work together to get another like this taken care of. Wound nurse will apply dressing to the open area. Then the CNA will reposition the patient with pillows every 2 hours. Keeping patients clean and dry if incontinence occurs will fix the problem. Assisting with activities. Sometimes you have to assist patients with some activities such as hygiene, dressing, getting in and out of bed, ambulating, which means walking, setting up meal trays, or possible feeding. Working on Alzheimer's or dementia units. You work mostly with patients with cognitive impairment. Sometimes they're unable to tell you their needs, so it makes a little times difficult at times. Sometimes CNAs might come across difficulties with completing patient care because of possible refusal or combativeness. Patients who are at higher risk for combativeness and mental confusion are prescribed psychotropic and or pain medications. The most reasons for combativeness might be from the pain, which that they might be going on. Importance of patient continuity. Cognitive impaired patients need a routine to make things familiar and comfortable in the activities of daily living. Sometimes you must accommodate the workplace. Patient continuity might not be there all the time. And for my conclusion, overall, working at a nursing home takes a lot of patience. CNAs must be caring for patients' needs. The CNA must work with the nurse to understand the specifics of the care that you as a healthcare worker must follow. Without knowing your patient's needs, you won't be able to perform the patient's care that is expected of you as a CNA. Overall, working in a nursing home takes patience to perform your job ethically. The CNA must be caring towards the patient's needs. The CNA must work with their nurse to understand the specifics of the care as you as the healthcare worker must follow. Without knowing your patient's needs, you won't be able to perform the patient's care that is expected from not only the nurse, but the patient as well.